Hello, everybody. This is Laura from Healthy Carnivore. I'm going to go over a little bit of my backstory so you guys know kind of who I am. After you've watched this, if you would, please like and share this if you know of anybody that could have some enlightenment with this information. And also you could subscribe to my channel and hit the notification bell. Sometimes it lets you know I'm live, sometimes it does not. Technology is great when it works, correct? Basically in 1991, I had went from 240 pounds in 1989 to 1991 of being 313 pounds, went to my family physician who immediately wanted to put me on Lipitor, which was fairly new. That came out around 87. Was going to have to live on that medication for the rest of my life and just knew internally, my gut said that that was not something I wanted to do. Therefore, I did look into what the medical industry before it was kind of hijacked in 1910 thought about these things. My cholesterol was high. My triglycerides were absolutely off the charts. Over 1,000. They don't really know how high. Their meter only went to 1,000. It went there in seconds. Normally, it takes several rotations to get there. Mine did not. So I went to the library, informed myself the old-fashioned way. No internet. There was none of that in 91 that I know of. And just, really took a big dive into medical journals and veterinarian journals from 1850 up through 1910. Just went home, got rid of the white bread, white potatoes, pasta, rice, sugar, all the things that, are not going to be the healthiest thing for you. Grains, especially, were something I did away with immediately. And in 9 months' time, I lost 153 pounds. My triglycerides were 33 when I went back to see the doctor. And of course, he's tapping himself on the shoulder because he had sent me home with a prescription paper back in the day for Lipitor. And that's when I broke the news to him that I had not taken that medication, which I had kind of told him I wasn't going to, but he didn't listen. We had a little bit more discussion of how he should have known how the body works. I shouldn't have had to have went out at a 20-year-old to dig up this information to figure out how the body works, and did fire him consequently for that. Did have some, I don't know, it's not retribution. I'm not sure what you would call that. Several years later in my nursing, working on a transplant floor, open heart floor, cardiac floor. Did have same said physician as a patient. Post 5-way bypass, post statins since 1989, diabetic, morbidly obese, vegan, at least vegetarian. I can't honestly say if it was vegan or vegetarian. So that was an interesting few days that I got to take care of him. The first day he was intubated, so he couldn't talk back, so I did all the talking. Anyway, so part of that backstory leads me to kind of who I am internally, which is I don't take anything at face value, never have, way before 2020 happened, 21, 22, I always want to know how things work. I want to know the root cause and let's fix the root cause. Always been something I've believed in. And medicine gets further away from that all the time. And unfortunately, a lot of that is because it is tied to medicine and political views. Um, I don't think this should have anything to do any political views. This is for human health, and I want everybody to be healthy and happy and whole. Okay, so I'm going to check in here just real quick just to see who's here, and then I will get into tonight's, which is something I love. Susan, Lydia, let's see. Oh, new member. Oh, well, thank you. Let's see. Tara is without power, so she's watching me on a phone. So she only gets to see this, which is okay. I can't imagine watching me on the TV, but let's see. Dawn's Charger, hello. Nice to see you. Sandy, hello. How are you doing? Free Thinker is here. Hello. And Simpson. We love Simpson. Let's see. T. Lewis. Hey, T, you're going to like this one. Janice, hello. And let's see, Brian, in 1991, the internet was known as World Wide Web. I guess that may be true. Not in my little community that I grew up in. I don't know of anybody who had it. Maybe they did. I will tell you at the library that I went to, the only way I could get anything out of these huge, old, thick, leather bound, crazy looking books, kind of like I was watching Ancestry, like Who Do You Think You Are or something the other day, and they had these big leather bound books. I mean, they're like 24 or 36, and I was like, that's what the journals look like, those old medical journals. It's so cool. But the only thing they had was like a Xerox copy machine. That was the only thing upstairs on that second floor that they had. And so that's what I did. I think they were 10 cents a copy. I spent a lot of money, lots and lots of money. Hey, Diamond, how are you? Okay, so I'm going to go over what tonight's topic is. And before I get real deep into it, I'm going to tell you where some of these guidelines got pulled from. It's quite interesting. So tonight's information is going to be what the new 2025 American Heart Association ACC blood pressure guidelines. Now, I'm going to caveat that with saying these guidelines were actually created in early 2024 and put into place. I'm not sure that these will hold up for very long. Okay. There's bigger fish to fry than this. So I think eventually this will be dealt with. So, where the information came from for these new guidelines that I will go over with you guys, it came from the Framingham Heart Study. So this is a big study. It has lots of people in it, but it was an observational study that started all the way back in 1948. My mother was a 1-year-old. It followed thousands of people in a small Massachusetts town to figure out what things actually cause the rise of heart attacks and strokes. Um, and of course, as we expect, a lot of the classic risk factors came from extremely high blood pressure, smoking, metabolic disease, and diabetes. Notice something missing that they tell you is the number one cause of heart attack and stroke? High cholesterol. Even though I'm sure people had 300s because that was considered normal up until like 80. Um, but that's not what's found. Anyway, so Framingham showed a clear pattern um, as to like extreme elevated, especially diastolic blood pressure, that those people did tend to end up with heart attacks and strokes. A lot of that is due to the metabolic disease, which causes inflammation, narrowing of the arteries, same with diabetes, which also then increases the blood pressure. If you're trying to squeeze fluid through a garden hose and it's clamped down because of these diseases, the pressure coming out the other end is higher. That's exactly how this works. Okay. So the catch is that the Framingham study looked at population risk overall. They did not do individual safety. So it didn't take into account the frail elderly people in the town, like it was just everybody. It didn't, people with autonomic issues, people with that were on multiple medications, that was not taken into account. Those who got dizzy and fell when systolic drops were too low. So when your systolic gets really low and you stand up and then you get what they call orthostatic hypotension, that's where your blood pressure drops, 10 points or better when you stand up from either laying, sitting to standing. So while the study did link higher BP to cardiovascular events, it really didn't say aggressively everyone into this 120/80 was safe either, because as you get older, the muscle is thicker and you should have a rise in your blood pressure. And when we falsely dilate all of your arteries and everything to get that pressure low, that's when you stand up. And of course, all that pulls down at the bottom of the body and you get dizzy and fall. So none of that was taken in. So later, guideline committee took the population data and tightened up the targeted blood pressure that they wanted. But the study showed very, very clearly that elderly patients did worse when they were treated and falsely made their blood pressure stay low. They had falls, syncope, kidney injury, and fatigue. Kidney injuries are so massive with this big push of wanting to keep blood pressure low. So you think about it, you think of ejection fraction. That is the percent. You want to be around 55 to 60% ejection fraction. Anything below that, you are not getting perfusion of oxygenated blood to organs that are distal, further away from the heart. So it's going to go to the places it has to go to first, and it's going to leave those other ones behind. Kidneys tend to be the ones that really take the brunt of that. I have seen that with several patients. If I had a 50 cents for every person I've seen that with, yeah, I would be, I would not, I don't know what I'd be doing. So reality is too low blood pressure can be absolutely as dangerous, if not more, especially in elderly. Um, Another issues that the doctors don't want to usually mess with is they, even though this study showed no correlation with high cholesterol, that's what they always want to push. And I'm always like, why don't we look at the particle size? Why don't we look at what does LDL do? It is a transporter. It carries your vitamin D, it carries your hormones, it carries your immune cells to the places that it needs to go. None of that's ever looked at. So that's just a little caveat of where these guidelines came from. Okay. All right. Let me just make sure I'm not missing anybody's information on here. Hey, Julie. And then Jiffy says, good evening, Laura. I generally use a different browser than Google, but have found I cannot participate in the chat unless I use Google. Geez, anyway, so glad to be here. Well, that's too bad. I use DuckDuckGo on my phone, as my search engine. I don't know. That's crazy. So what is new with the American Heart Association blood pressure guidelines? So basically, they kind of kept their normal where they want you at the 120 over 80. They consider anything over 120, so 122 over 80 or 82, they consider that elevated. That's going to be stage 1. Stage 2 is 140 over 90. I promise you, this is not medical advice, but I can tell you, as being a nurse, my patients that are elderly absolutely 100% of the time function, still living, going to be 100, many of them coming up this next year, with a 140 over 90. Absolutely. Not, they have no symptoms of like impending doom. They don't have like stroke symptoms. They don't have any of the things that you have. And their kidneys are getting perfused. When these same people are put on usually 4 or 5 blood pressure medications and it knocks their blood pressure down, all of a sudden they have acute kidney injury and their kidney numbers go to hell. Well, that goes back to we're not treating the whole person with all these multiple systems that work together. We're just pinpointing one thing and we're not even going after the root cause. We're just falsely dilating these people's blood pressures. And as you get older, you have a higher risk of falling. So if you fall and, cut your hand, we can put pressure directly on your bleed. You fall and hit your head, we can't. And most of these people are also on blood thinners. It's not a good outcome. It's not a good outcome. So, like the stage 2, like I said, I totally 100% disagree with those numbers. Now, if you're 16 and you're sitting around at 140 over 90, yeah, we need to see, like, are your kidneys working correctly? Do you have some pulmonary hypertension? Do you already have some blockages? I believe in the next 10 years, we will see people having open heart bypass in their early 30s. We're already finding it at 39, but I think it will even go lower because of the junk. So, one thing that they found was table salt, not mineralized sodium, like, Redmond's Real Salt, Celtic, Baja, all of those that are mineralized, that are left alone basically and not ruined, um, that those were fine. But regular table salt, if they took in more than 1,500 milligrams a day, that it increased the blood pressure. It caused, issues with how the vascular system, stretches or not, which you kind of need. Alcohol, they said they're leaning more towards complete abstinence. Though if you drink, stick to less than one a day for women and less than two a day for men. Brain health, the reason that they bring this in this time, which I agree with this, of having brain health be part of the importance of blood pressure as a symptom, is you have higher cognitive decline and dementia with people who have blood pressure issues. But it's not the high blood pressure people that you're seeing it in. It's the people who have the low blood pressure. Because how far away is this from the heart? How far away are the kidneys? Liver's doing great, stomach's doing fine, lungs doing fine, all right there in that, so close. These other entities are further away. Those are the ones you see trouble with. Um, Another thing is, this one drives me absolutely bonkers. And if you've ever followed Dr. Barry, he has went through this as well. But as a cardiac trained nurse, like cardiac nursing 101 was, before you do somebody's blood pressure, you offer them to use the restroom to empty their bladder. You give them 10 minutes of rest before you put a blood pressure cuff on them. You take shirts off and you have your blood pressure against bare skin. You make sure that their legs are not crossed. You make sure that their feet are not dangling over a table and not touching the floor. They need to be sitting in a chair where both feet can touch the floor, or if they're up on a table, they need the step thing out so that their feet are touching that. Because if you're compressing behind the knees, any of those things, crossing, having a full bladder, being there within, doing it within a minute of entering the room. And if you have white coat syndrome, which not everybody does anymore because of what has happened over the last so many years, that can falsely elevate your blood pressure 20, 30 points, and doing it through several layers of clothes. I love it when they're like, oh, I can hear it. Well, that's great that you can hear it. That's not what the problem is that you're measuring it through several layers of clothing and it's not accurate. So I usually let them do that to me once. And then I'm like, now do you want to go ahead and do the blood pressure correctly and I'll have my shirt off, or I'll move it, so you can get to my skin. Then they're like, yeah, I can do that again. I'm like, yeah, we're going to. So just know that those things is what lead to having a proper blood pressure taken. And you have the right to say so. Another thing is, I always ask these kind of questions. Why do these guidelines keep changing? So we know that a lot of this is pushed by public health. So the concerns are hypertension is still ridiculously common. Almost half of US adults, it remains the number one modifiable risk factor for major disease, including stroke, heart failure, and dementia. Yet you go to, this is what, gosh, drives me insane. So you go to the hospital, you have a heart attack, we put a stent in you, we give you Plavix, we put you on a cholesterol pill, we probably put you on a diabetes medication orally, and then we've served you Jello and cereal and all these bread products and skim milk because it's so heart healthy. Oh, and Cheerios. Yes, and oatmeal. Um, Mind blown. Mind blown. A third grader would know better than this. Anyway, so lifestyle should really be the first line of defense, which is what when I work with my clients or my home health patients, it is always, what can we change? What can we do? And sometimes it's talking with their doctor and saying, you do know that you have this person on 4 antihypertensives. So to bring their blood pressure down, I've had this happen twice in less than 6 months. And you have them on a pill called Midodrine, which is to bring the blood pressure up, and they're taking all 5 of them together. Now, does that take very much sense to know Why would you be having a 90-some-year-old person taking 4 meds to bring down their blood pressure and another pill to bring it back up all the time? Not take that low one only when you're getting orthostatic hypotension, which there again, if that's happening, you are falsely lowering their blood pressure. Twice I have had this happen with people, and yes, they were in their 90s. So I always try to be like, I work with the doctors, um, and say, hey, the family wants to do this. This is what they're going to try. Just want you to know. And they have that power at home, where in the doctor's office, sometimes they don't feel like they have the power to say those things. So, better health by trying to change what you put into your body, do with your body, those things is always going to beat pharma profit. But that's for us. Those people who have big money tied up in pharma, they don't want that. So that is why you will continually see them lower the numbers, just like they did for cholesterol. 300 normal, then it was 260, then it was 200, and it's 179. Because if they can continue to lower that, then they can try to force you to take these things. Remember, just because anybody says you have to take this medication for this, you have the right to look at it. You have the right to say no. You have the right to take it. I mean, you have those rights, but you do need to know everything about those. So, guidelines can evolve as the science improves. It is just a very slow motion. Okay. So, medical, so this is what I say. So when it comes to the medical, they are diet heart hypothesis. They are just married to that. Okay. So since the 1960s, the American Heart Association has pushed the idea that saturated fat raises cholesterol, which causes heart disease, even though the study, Framingham, didn't even mention that. Okay. It's not even one of the things. So keto and carnivore type diets directly contraindicates that, because there's ways of eating that are high in animal fats and in cholesterol, but yet all of these studies that I will go over with you show that that decreases your blood pressure, decreases metabolic disease, decreases diabetes, decreases all of these things that they're talking about. And some of them take some time. Fatty liver disease goes away very quickly if you do it correctly, very quickly. 3 months, I've seen somebody that had the worst looking liver in my life to look like a newborn baby's liver. Um, so new data challenges the old theory, but institutions are very slow to pivot. They stick with decades of messaging, and I can tell you that is true firsthand. Um, so industry ties, that's the other thing, is when you see who paid for some of these studies, it just, like, you see the name Quaker and you see the name Kraft, and it's like PepsiCo, and I'm like, what? How is that even, shouldn't even be allowed. So anyway, the hierarchy and the bias of this is that keto carnivore research is newer. It's often smaller in scale than the massive epidemiology studies that were backing, like the Mediterranean and the DASH diets. But most big nutrition studies are funded by pharma and the food industry. They are not funded by the meat and the egg producers, because they don't have enough money to go against these people. So pretty sad. Um, and of course, they're always going to be cautious about liability. But what I remind my physicians are, you can document that you've discussed this with me, that these are the risks that you say that are associated with this. You can also put in your notes that I am well informed and that this is what I choose to do, which takes the liability off of you. So they want like we all know, they want this broad one size fits all advice. The irony is more and more studies show that keto and carnivore reverse metabolic syndrome, fatty liver, type 2 diabetes, obesity, plus more. The very drivers of high blood pressure and heart disease that the American Heart Association says they're fighting. But until the institutional inertia and funding biases shift, don't expect them to do much more than what they're doing. I do think hopefully we'll come to a little bit of a change, but like I said, I think there's bigger fish that they are working with right now. This will be later. So some of the research that studies that I went to look for is meta-analysis and systemic reviews, which was 2024 GRADE. That's all in capital letters, GRADE. It's an assessed meta-analysis of 29 clinical trials in patients with type 2 diabetes that were put on very low ketogenic or carnivore diets, significantly reduced all-cause mortality, including high blood pressure, stroke, diabetes, all the things. Fasting blood sugar, hemoglobin A1C, and insulin resistance markers all dropped. Triglycerides all dropped. Systolic blood pressure decreased by 2.85 and diastolic by 1.4, which is not a ton of a drop, but sometimes it's enough to appease the doctors. An umbrella review of meta-analysis reported moderate to high quality evidence that ketogenic carnivore diets, so either or, improve various cardiometabolic parameters, though they typically also raise LDL-C, and long-term outcomes are yet to be seen on those. That is where I always recommend people get the particle size of the LDL because it does matter. So, a 2022 RCA meta analysis of 1,074 overweight, obese participants, some with type 2 diabetes, found keto diets, ketogenic diets, whether that was keto, ketovore, or carnivore, lowered fasting glucose, reduced their BMI, weight, waist circumference, decreased triglycerides, and raised their LDL. So I think most of the talks about that. There was another diet comparison model trial in 2025, early 2025, and it compared 8 dietary patterns using the RCA data, including ketogenic, low carb, carnivore. It ranked diets by impact on weight, lipids, glucose, and blood pressure. Let's see, another one was in 2025, there was only a 12-week trial in obese individuals comparing keto versus time-restricted eating, found that keto showed stronger improvements in the lipid profile, systolic blood pressure, and glycemic control, especially in older, high-risk subjects. So another thing, this is a good study too, is the keto CTA study in 2025. So it found that as these people did these diets and got metabolically healthier, that the changes in the LDL-C or the ApoB did not correlate with increased plaque progression. So that's where they get a CAC scan. They maybe got a CT angiogram so they could see the soft plaque, and kind of like I had done. And then years later, after being carnivore for 2 years or better, went back and had 0 plaque down from what I had had to begin with. So I also saw that in my own self. Real world population data, 2024 analysis of NHANES data suggests that people adhering to a ketogenic or carnivore diet had lower overall mortality with no increased risk in cardiovascular mortality risk, including high blood pressure. So, with that being said, you know, this is I had an ex-patient call me on my home phone one time because he couldn't remember my cell phone number, and so we still have a landline, and he looked it up on my husband's name, and he called and said, "Laura, I think I need you to come down and check my blood pressure. My little home machine says 240 over 110." And I'm like, "Do you have a headache?" "No." "Do you see spots in front of your eyes?" "No." "Do you have ringing in the ears?" "No." "Do you have a metallic taste in your mouth?" "No." "Do you feel like your chest is wanting to just like you have pressure?" "No." I said, "I'll be right there." If I'd have truly thought that was correct, that he had that, I would have called 911. He literally lives less than a football field away. I went and checked his pressure and he was 134/70. That was just his machine was off. But that's where you have to go and say, "How do I feel? Do I have any of these symptoms?" My thing is trying to protect our organs and the entire system together. And I think a lot of times with these guidelines, they are so laser focused. And I didn't realize how bad that was until I went into the cardiac world. And I literally had cardiologists. I mean, they were like greedy, they just were greedy. It was like all this contrast we're shooting into you while we're doing a heart cath, and you may have already questionable kidney function as it is. You may be on dialysis, and we are frying the hell out of your what little kidney tissue you have left. And like if it's saving your life, I guess that's a choice. But when it is, you don't even have blockages, and and I had that happen a lot. No shortness of breath, not in there because you've had an MI, no failed stress test, nothing. Nothing that should warrant you to have to be in there to have that done is what I saw. But I saw them, I'm like, "Hey, like, we're past their," we had a ratio that we went off of based on your GFR and stuff, to know how much contrast, and we always there's Omnipaque and Visipaque, and one is just more of a straightforward contrast, another one is more of a little safer on the kidneys. It's less caustic on the kidneys. So we would always use that. But these docs would be like hammering this person, and I'm like, there's nothing there. Like, what are we doing? And they're like, well, we fixed their heart or we angioplasty them so they balloon open an area that looked a little suspicious. And so we've done great. And I'm like, yeah, we just went like 40 minutes past when we should have with their kidney function. And literally, I had one of the doctors who doesn't work in the state of Illinois or Iowa anymore. Unfortunately, he's in Missouri. Say to me, "Yeah, but his heart's good." And I'm like, "Who gives a shit? Like, it doesn't matter. This person's going to be on dialysis." And they were, and they died. So it's like you got to look at the whole big picture. So, but that is where I say we as consumers, like if they want to treat themselves as a business, that's fine. I'm a consumer. Consumers are always right. Remember, customers always right. And you have a right to stand up for yourself. You don't have to be dickish. You don't have to be hateful. Just merely stating what you will and will not put up with. And you may have to change doctors. And it's not because I want you to find a doctor that always agrees with everything you say. Mine doesn't agree with everything I say. I could find one that did. I choose to stay with her. I like her. She listens, even if she doesn't want to. I hand her studies. She does follow through and read those. So, and she's eating eggs. So I'm happy with that because that was something she had never done. So, I'm not saying you have to go out and fire every single doctor, but I do think you have to stand up for yourself. And if they take offense to that, one of the best statements my mother made many moons ago to a doctor in University of Iowa who was being over the top asswipe and very arrogant. And she said, "Arrogance is the anesthetic that numbs the pain of stupidity." And I mean, I was like 6, and I remember that because he walked out of the room like smug and ha ha ha. He came back 15 minutes later when he had time for that to like trickle down, and he was like, "Excuse me, you think I'm arrogant?" Yeah, yes, I do. So it was pretty interesting. So I always keep that one back there just in case. I don't want to ever have to pull it out, but I'm gonna if I have to. So let's see. I just want to check and see if anybody else was on here. Oh, you use DuckDuckGo. Good. Thank you. I'll try DuckDuckGo. Yeah, I've had really good luck with them. I had somebody say, "Oh, Google bought them," but I promise you, I've used DuckDuckGo to look up things, and I've never had anybody get my information. I've never had, how you go out and look up something on Google, and then 20 minutes later, your Facebook ads are everything you just looked at or you talked about. I don't have that because Google is not on my phone. It is off my phone. Let's see. I operate at 140/80 with no issues over 65. I am told they want to watch me. They want to watch you. Say, okay, go ahead and watch me. Everything's fine. You feel fine. Your body's natural system, pain when there's an issue, whether that be heart attack, pain, headache. I mean, you're going to have pain when there is an issue. You're going to have these symptoms when there is actual problem. It's kind of like the old days of when you had to be tested to prove you were even sick. I mean, a lot of us healthcare workers went to work every single day and not sick, but still had to be tested. And then, oh my God, I tested a whole brand new ream of paper and it was positive. Go figure. I don't know how that happened. Anyway, I don't think you should have to be tested to find out that you're sick on something like this. So I think T, keep doing what you're doing. I think you're doing fine. Let's see. Jiffy says, my heart nurse practitioner keeps trying to put me on more BP meds. My BP yesterday was 129 over 79 with the pulse of 65. I took all the meds she wanted to give me. I would be pushing if you did. If you took all the meds she wanted to be, yes. Well, slowly. Remember, a customer that dies is a customer lost, just like a customer healed. They really don't want either end of the spectrum. They want to keep you and manage your disease. So I'm glad you don't take all of them. Janice says, I take 3 blood pressure meds, 69-year-old. I'm thinking of fasting again. Carnivore, 0 calcium score. I'm sure dealing with insulin resistance. Yes, insulin resistance and fatty liver, major contributors. And I think as you go on in time, you will see that that will come down. And, you want to try to work with your practitioner of as those things come down, things improve, that they do like medication holidays where you take a week off of some and see how you do, checking your blood pressure and stuff daily. So, let's see how to test for fatty liver disease. Well, if you do a CMP, which is a complete metabolic panel, you will look at your AST and your ALT. But most people that I have worked with clients on my website have like CT scan or MRI images. And it literally, you've got the lobes, it kind of comes down like this, and it will look like cauliflower growing out of it. It is the craziest thing I've ever seen in my life. We didn't used to see it until men in their 60s got it, and it was usually from alcohol. This is non alcoholic fatty liver disease. Super fixable. I had a gentleman, um, borderline diabetic, borderline kidney disease, who had the worst looking liver I've ever seen in my entire life. And he wasn't even 40. And in 3 months of him doing it, not even me, he was already on the track, but just seeing it. And it was like, oh my God. And 3 months later, it was as smooth as a baby's butt. It was amazing. Let's see. So Brian has a question. What are your thoughts on these automatic blood pressure machines? I don't like them. Zero. Zero. I do not trust them at all. Um, and not that this is anything to actually do with blood pressure, but during my clinicals as an LPN, licensed practical nurse, many, many, many years ago, over 25, um, working or doing my clinicals at a hospital. I had the ICU patient. They just had one room, little hospital, hooked up to all the automatic stuff, had the little telemonitor up there and it showed everything, mean blood pressure, um, everything. And I went in and did my assessment and came back out quickly. And my instructor said, well, you couldn't have done all the assessment because, how long it takes. And I said, well, they're hooked up to a blood pressure machine and a pulse ox. And she goes, no, I want you to do a head to toe and I want you to physically do the blood pressure, check the pulse manually, apically, and at the wrist, which I do at the same time. I like to do that to see if there's any variance because there can be. And it kind of leads you to what might, you're like, oh, we might have a little tortuosity in some of our arteries between those two places or a blockage. And anyway, so I went back, and not that this is the blood pressure, but this is just to tell you that those machines they're not it. But you also have people, you need to have people who know what the hell they're doing when checking these things too. That's the other scary thing. But anyway, listening over the person's heart, and you listen over the 4 areas. That's how I was taught to listen over the valves. One of his valves, I believe it was the mitral valve, had a whistling sound over it. Like when you listen to it, it's like, and I was like, what the shit is that? It kind of sound like when they listen to a baby's heartbeat in your belly and you can hear that. No, that's kind of what it sounded like. but I was like, but I had to keep a poker face, and I don't have a poker face, but I was like, "Oh shit, I don't know what this is." And went out to the nurse's desk, and my instructor was sitting there next to the doctor. And I said, "There's a whistling sound over the mitral valve. I've never seen so many people move so quickly in my life." We got him on a helicopter, sent to a larger hospital. They went in, did a right heart cath, and actually grabbed a clot off of that mitral valve, one of the flaps. I think he had some stenosis where it wasn't opening completely, and so blood would sit still there and made a clot. Pressure was fine. Everything looked fine on the machine. So, no to trusting the machines. Just think someday they said AI is going to take over all the jobs, including nursing. Sure. Good luck. Um, let's see. Jiffy says, "Hi, Laura. You know more than my heart failure nurse practitioner. I just joined because I trust you." Well, the sad thing is that when I talked even like to my doctor, I'm like, "You know this stuff. You took the exact same courses. I took the higher level courses for, even though I knew I was only going into nursing, but I took the higher level, the same ones that they gave the doctors because I wanted to push myself and strive for the highest I could, knowing I've never wanted to become a physician ever, but I wanted those. And I always say, you took these same classes, you know, and then you went to the medical school part, which was all pharmacology. It is never what can you take this? Can you stop doing that? Can you walk a little more? Can you put down the regular table salt? Let's get you some mineral salt and see. They won't do it. They're not trained to do it. And even if they did do it in these big hospital systems, they're going to get their hand slapped, get money taken back from them, lose their positions, even sometimes lose their jobs. And yeah, they could go out on their own, which is what I would do if I was a physician. I would get with some other like-minded physicians who have cojones, and I would open up an office, a standalone office. It can be done. There are physicians in my area that stayed that way. They refuse to go under these systems so they don't have to follow the Standard of Care Act, which sounds good. Like, I don't want my doctor below standard of care, until you know that the people writing the standard of care aren't even freaking doctors. And it is everybody must be on a statin. Everybody must be below this. Can't use this. Can't use anything natural. Don't use ivermectin, don't use elderberry, don't use, I mean, all of these things. No, thank you. So yes. Let's see. So Jiffy says, "I am in the Emory system. Very sad for the medical staff." It is. It is. But they make the choice. Okay. So, and yes, it's a hard decision to make. It was a hard decision in 21 for me to stand up for myself and say, no, thank you, and be fired from a job. Ultimately, they had to hire us all back a month later. But I stood for something because I am not for sale. They're not buying me. They're not going to make me talk people into doing something against their will. I'm never going to do it, and including for myself. But that's the kind of people I want taking care of my system, my health. And I will educate them because that's where they learn. So when I first became a nurse, I knew what the book said, even though a lot of it I was like, this is bull crap. I already know better than this because I'd already been keto for several years. And I knew enough to listen. So I listened to all of my patients. I listened to their families. I listened to old nurses. I listened to new nurses. I listened to everybody, and just like a sponge, you take it all in, but you have to have some time under your belt to see how these things how they play out. And I think we'll see a lot of things changing in the next few years. I really, really do. Um, yes, I think a lot of the medical systems are going to fall. Um, and at first I was like, dang, I hate that. But you know what? I really don't. I really think that it's going to have to happen because it's like anything else. They get such a monopoly and they get so big that they quit caring about the outcomes of patients. They literally never in my over 23 years have I had a hospital administrator, whether that be a chief nursing officer, whether that be a CEO, doesn't matter who it was. Never did they come to me and say, How are your patients doing? How are our patient outcomes on the floor? Like when I was charge nurse, never. It was how many more beds? How fast can we get them discharged? Get the room turned around. Get somebody back in here. Da 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 da. That was it. I mean, it was always about that. It was never how were your patient outcomes. It wasn't the whole wall that had my name and a lot of the other nurses and staff that I worked with. Be a Star awards is what they were called, where families and patients and stuff would give kudos to people doing their cares if they got good care. No, nobody looked at that. Not that I care. Like, I don't have any of those. I didn't even take them with me when I left there. But I did think that that's nice because those people really did know that you took time and you had ethics and you had morals and you had values. And so to me, that's more important than making the hospital administrator happy. So yeah, I do not care what they think. Let's see. Laura, I hope you are correct. Money seems to be the driving force. I promise you it is. I was inside the system for a long time. I worked in the cath lab, watched it, open heart, watched it, um, clinic job, watched it. I promise you. If people were allowed, which I think should be public knowledge, if you can see, okay, so like um, a hospital that is for profit, yes, for profit, you don't get to see their financials, but a non for profit, you can go out there and see all their financials. But guess what? You don't get to see? You don't see any of their bonuses. So that is where they slide a lot of this money under the door that the average public person doesn't even know it's there. But you see it when you work in those places because you're like, didn't you just get a Porsche last year? Oh, yeah, the Plavix guy. The Plavix guy. But you can't drop a pen off for the nurse's desk because that might be buying our loyalty to their medication. But the doc just got a brand new Porsche, second one in less than 2 years. Okay. And that's just little. That's not even a tip of the iceberg. So, okay, I'm going to calm down because it gets me very worked up because I don't like it. It's not right. Um, anyway, let's go over next week's talk, which will be less, I won't be so inflamed. Next week's talk is going to be over sarcopenia, which in my age group, 54 and above, and even under that, sarcopenia is a very big deal. So I'm going to go over a lot of stuff with that, what it is, ways to kind of combat that. Yeah, and there's lots of stuff. So anyway, hopefully this was informative. I do appreciate every one of you guys for being here. If there was something that you found that you could share this with somebody that maybe is having some issues with this or their healthcare team, this can maybe give them some things that they can ask their doctors. I want people to be informed so that they can make good decisions and have that conversation with your doctor. And any doctor that doesn't want to have that conversation with you is not the right doctor. It's time to find somebody new. And as I said, doesn't mean it has to be somebody who agrees with everything, but it does need to be somebody that left their ego in the back room. Okay. Because there is no room for ego. It's your life, it is your health. And you get one time. So I'm always like, let's make the most of it. And I want to get as many 100-year-olds as I can. I really think as long as you have good health and your memory, that's the way to go. So anyway, I will see you guys next Monday for sure. And we'll go over the sarcopenia, which I do like too. That's pretty important. It's a big deal. It's something that I've dealt with, especially once I turned 50. And so I will go over that. So thank you guys for watching. As I always say, meet, heat, eat, and repeat. See ya.